Hello to everyone, and in this video we'll be discussing on the topic of our tumor collapse syndrome. So first of all, it is also called as TCS in the short form, and another name is tumor lysis syndrome or TLS. And according to definition, the meaning is that when the tumor or the cancer cell dies and they secrete various substances. Okay, so those substances can be like electrolytes and other toxic substance, and if their death is so rapid that the kidney cannot filter or remove these substances from the bloodstream, then it is called as tumor collapse or tumor lysis syndrome. So it is also called as tumor intoxication also in other language you can say. So this is a basic definition regarding the tumor collapse syndrome, the dead cancer cells which are left in the bloodstream and that lead to the tumor lysis syndrome. And other what it includes, what imbalance does it do in the blood, that is in the molecules of the blood. That is, you can see the high level of uric acid, that is called as hyperuricemia, increase in the level of potassium, hyperkalemia, increase level of phosphate, hyperphosphatemia, and decrease in the level of calcium maybe, that is called as hypocalcemia. So this means the imbalance in the molecules or electrolytes, those are present in the blood. So it can be increase or decrease. So it depends on the tumor, which type of tumor it is. Okay, so what happens when does this TLS developed in most of the time, and in which tumor? So when it develops, so it develops in the first days of tumor treatment. So actually it develops during the anti-tumor therapy, which is chemotherapy. So during that there may be highly proliferative activity of the tumor dividing cells. So these cells may be highly dividing cells during their treatment, which is done through the chemotherapy. In that case, this tumors can collapse and release the toxic substances, which can lead to the tumor collapse syndrome. So this occurs during the treatment actually. So what are the most common tumors in which this develops is the Burkitt's lymphoma, Hodgkin's lymphoma, okay, and acute lymphoblastic leukemia, that is a blood cancer, hepatoblastoma, the liver, and the stage 4 of neuroblastoma. Okay, so these the last two cancer, the hepatoblastoma and neuroblastoma, they cause impaired kidney function before the treatment. So in these cancer, this tumor lysis syndrome may develop before the chemotherapy or anti-tumor therapy. So the kidney is impaired before the treatment. So in those two cases, so the effect is on the kidney when the kidney is not able to filter the molecules or the toxic substances. Okay, so the main concept is this. Now we have the risk factors for the TLS. In this case, we have the increase in the leukocytes of more than 1 lakh per ml. This is one of the risk factors, and the cancers which are in the advanced stage, those are in the risk of developing tumor collapse syndrome. So advanced stage of tumor, and increase in the activity of lactate dehydrogenase enzyme in the serum. If this level is increased, then you have the risk of TLS. And if there is impaired renal function or kidney function, that is, it can be renal failure or somewhat the pathology related to the kidney. Now, what are the violations we see in the TLS, that is a tumor collapse syndrome? So first we observe is hyperuricemia, as I told you, hyperkalemia, hyperphosphatemia, hypocalcemia, and decrease in level of calcium, and non-respiratory acidosis. So these are the processes you will, or the imbalance you will see during the violation of the blood, violation of the kidney. Okay, now the symptoms of TLS. What are the clinical manifestation? We will see the abdominal and the lumbar plane in the patient. The patient will come with the nausea or vomiting, tremors. You can also see tremors, and due to the increase in this calcium, that is increase in this electrolytes like potassium and phosphates. So this can lead to the rapid heartbeat in the patients, which can lead to the heart pathology, heart failure. Chest pain may develop, abdominal pain may also develop, arrhythmia can also develop, irregular heartbeat can go up or down. So that is the case of arrhythmia. There will be muscle weakness and epileptic seizures also. So these are due to the increase in level of your potassium. Now skin itching, this is also the symptom, and somewhat ulcers in the skin you can also see in these patients. Now what are the complications of TLS? Complication after TLS, the patient can develop disorders of consciousness, that is called as coma. So this is the neurological disorder, that is coma. There can be heart failure also, cardiac failure, sudden death. In this case, the patient can develop after the heart failure. And the important is your acute renal failure, which is the most important organ which is linked to this TLS. Okay, so now we have to see some point related to acute renal failure. It's important. Now this occurs when the kidney is unable to filter blood and leads to the release of toxic substance, as I told you, in the internal environment. Internal meaning in the blood of the body. Okay, so the whole bloodstream of your body, there is release of the toxic substance as your kidney is not able to filter the blood, and this leads to the other pathologies which is called as your cardiac arrhythmia and coma. So after acute renal failure, there is development of other complications with respect to your internal environment, changes in level of electrolytes. This can lead to your cardiac arrhythmia, other pathology in the heart, and in the neurological you can develop your disorder of consciousness, which is called as coma. Now what are the diagnoses you will do? We will do the lab diagnosis or instrumental diagnosis. So first of all, we do the test of uric acid, level of uric acid, lactate dehydrogenase level, potassium level we will check the phosphate levels, we will check the level of calcium and level of non-respiratory acidosis, and we will do the test for creatinine level also and the GFR rate also, what is the glomerular filtration rate of the patient. And in the instrumental diagnosis we will do ECG, okay, to check the cardiac disorders due to the electrolyte imbalance. As I told you, the change in the level of your potassium or calcium or phosphates can lead to somewhat pathologies of heart. In this case you can see hyperkalemia, hypercalcemia, which you can see on the ECG, the elevations on S wave or ST waves. So we will do ECG in this case, the instrumental diagnosis. Okay, now you can see some images also here, images, tumor collapse syndrome, like in this case of your stage 2 lung cancer. Okay, yeah, this is your, so this is your cornea and this is left main bronchus, pleura, and this is the part of all the lung has been collapsed or the patient is having pneumonitis. So this is the stage 2 of lung cancer in which pneumonitis has developed and this area of the lung has been collapsed. Okay, so inner membrane of the covering the lung, you can see the primary tumor is larger than 4 centimeter but not larger than 5 centimeter. So this is a case of your collapse syndrome. And another image you can also see here, this is the location of lung tumor in the right main bronchus. Tumor in the right, you can see this white area. Okay, so this is 3 by 4 inch tumor located in the right main bronchus, in the right main, and 1 inch distal to the bifurcation of trachea. So this is a bifurcation of trachea, so it is present and causing a collapse of all lobes of the right lung. Okay, so this is the main examples related to this tumor collapse syndrome. Now prevention of TLS, what you will do to prevent this syndrome? So now we can concentration on the uric acid level, potassium, calcium, phosphate, lactate dehydrogenase level, creatinine is regularly measured. So these are the prevention you will do. You will check the fluid balance is controlled or not of the patient. You will check the diuresis, that is the excretion of urine. What is the amount of excretion of urine you will measure regularly or somewhat. We will keep the measure of this, and ECG will be performed regularly. So these are the prevention you will do. What are the treatments you will do? In treatment you will do the infusion therapy. Infusion therapy meaning you will allow the kidney to filter properly, so you will give an infusion therapy for that to the patient, and there will intensive monitoring of the patient, and for decreasing the uric acid level you can give allopurinol to the patients. Okay, so this was your tumor collapse syndrome. Okay, thank you.